A groundbreaking study has turned the epilepsy treatment world upside down, challenging long-held assumptions about the nature of this condition. For years, experts believed that treatment-resistant epilepsy was a stable, unchanging condition, or one that only worsened over time. But this new research reveals a surprising truth. A subset of patients actually experience seizure relief, even after trying multiple medications. The study, published in JAMA Neurology, is part of the ambitious Human Epilepsy Project, a large-scale observational study involving researchers from multiple institutions, including Yale's own neurologist, Hamada Hamid Al-Talib. Researchers set out to investigate whether seizure frequency in treatment-resistant focal epilepsy, FTRE, improves over time, and if so, what factors contribute to this improvement. The conventional wisdom was that once you've tried 2 medications, the chances of the third or fourth making a patient seizure-free were slim, less than 5%, Al-Talib explained. But our study showed that some patients do improve, even after trying multiple medications. We even found a small group, about 17%, who were seizure-free for 3 months, which is a significant achievement and challenges the current understanding of this condition. The question remains, is this improvement due to new treatments, or does seizure frequency naturally wane over time? Researchers are still analyzing the data to uncover the answer. The why is the million-dollar question, and we don't have the answer yet, Al-Talib said. But the fact that we've seen real improvement is a game-changer. It shakes up the entire field of epilepsy treatment. Globally, epilepsy affects between 0.6% and 1.4% of the population, according to Al-Talib. The good news is that many patients, around 40% to 60%, become seizure-free with anti-seizure medication. However, for the remaining 30%, their epilepsy is medically refractory and doesn't respond to medication. The Human Epilepsy Project is a long-term study with 3 phases. The recent paper focuses on the second phase, which followed 146 patient volunteers aged 16 to 65 from 10 epilepsy centers across the U.S. between May 2018 and September 2021. All participants had focal epilepsy and had tried at least 4 anti-seizure drugs without success. The study collected extensive data, including seizure frequency, medication use, device use, brain imaging, surgeries, monthly check-ins, medical record reviews, and case report forms. This study is unique because it's a large epidemiologic study with a wealth of biomarkers, genetics, and neuroimaging data, Al-Talib noted. Researchers analyzed this extensive data, with Yale's Biomedical Informatics and Data Science Department coordinating information from both the first and second phases of the study. We played a major role in data governance and managing this complex data, Al-Talib said. We leveraged our informatics experts and other expertise. Many Yale faculty and staff contributed to making this study a success. When researchers compared each person's seizure frequency during the first and second halves of the study, they found that most people, about 68%, experienced fewer seizures in the latter part. Another 13% were seizure-free for at least 3 months, 8% for 6 months, and 3% for a year or longer. Medication changes and interventions, such as brain stimulation, varied among patients and yielded mixed results, with no clear winner. While many interventions exist, it's still unclear whether they alter the long-term course of epilepsy or if patients simply improve over time with ongoing care, the researchers say. One key takeaway from the study is the importance of including a control group when assessing treatment effectiveness. Open-label studies, without a control group, should not assume that treatment alone causes improvement, as some people experience an improvement without any intervention. This work highlights the importance of continuous medical management and rigorous, controlled studies to understand what truly drives improvement, Al-Talib said. Ultimately, we want to improve people's quality of life. That's the goal of healthcare. The study's findings challenge the status quo and open up new avenues for epilepsy treatment research. As Al-Talib noted, at the end of the day, we want to improve people's quality of life. That's why we are in healthcare. What are your thoughts on this groundbreaking study? Do you think it will change the way we approach epilepsy treatment? Share your thoughts in the comments below.